So now I'd like to show you reflexology for the hand. So if you just lift your left hand up like you were going to shake hands with the left hand and take a look at it. I want you to take your right hand now and start with your fingertip or your pointer finger. And just squeeze it lightly and then squeeze it harder and move down your finger, squeezing it as you go until you find a spot where it feels pain, where you feel a lot of tension or tightness. If you don't feel any, go to the next finger. And you start at the top, you just pinch it and keep pinching it as you go down. Where you feel any pain, stop. Where you feel any hardness, tension, stop. You found some, press it and hold it until the pain goes away. Then press a little bit harder until the pain goes away. And then a third time, press it until the pain goes away.
Feels better.
And when it does, proceed down the rest of your finger and go to the next finger. And then the little pinky. What you've done is you've just gone through your head from the inside of your eyes all the way out to your ears. Now we go down to the thumb and do the same thing. And here we are right in the middle of our head, just to the left of our center line. And press as we go down. That completes our analysis for the head. Now, the next part of our hand is above the palm, at the top of the palm. We call it the pad. The pad goes across underneath the fingers. Where the fingers connect to the pad is where our head connects to our shoulders. And then the pad is underneath it, which is our chest area. So starting underneath our pointer finger, let's just go across, all the way across the pad until we find a place where there is some pain. And where we find it, stop and put more pressure on it.
Right there, yep.
And when the pain goes away, press it harder until the pain goes away a second time. And then press harder still until the pain goes away a third time. And when it goes away, continue across the rest of the palm, the rest of the pad. And that brings us now to the hollow of our hand. The hollow of our hand is our abdominal area, and notice that it's larger than our chest area, which was just above it. But you can use multiple fingers, or you can use one finger and just go across the hollow of your hand as many times as necessary until you go completely across the hollow from one side of your hand to the other, and you don't miss any spots along the way. But if you find a spot where it's tender, where there's some pain, stop and hold it. And press harder until the pain goes away. Then press harder a second time until the pain goes away. And then continue your scan of your palm of your hand.
Okay.
And when you're all done, we come out to the heel. Now, the heel of our hand, like the heel of our foot, is related to our legs. And as you're going across there, most women don't feel a whole lot in their leg area. Men will. I'll explain that to you here in just a second. As a man, I can tell you I do feel some pain there, and so I'm holding it and stopping and moving on to the next one and the next one. And when I'm completely done, what I've done is I've taken an emotional scan of my body. In my head area is where I store my anxiety. That's where my anxiety starts. I get an idea in my mind and it goes round and round and I just kind of cannot let it go. And the next thing I know, I'm anxious. I'm fearful. The pad, the chest area, is where most women will start to feel depression.
Mm-hmm.
Most men are still feeling anger in that area. But their anger has started in their feet and their legs and moved up to their chest and will settle eventually in their belly. Most women will feel their depression in this area, the chest area. I'm sorry, this abdominal area is where their depression goes.
Mm-hmm.
And their anger, they store in the pad, the chest.
Mm-hmm.
And the anger will go down into the depression area once there's no place else to store anger up there. Men store their depression in very interesting places. They store it in their head because
Mm-hmm.
they get thoughts that just make them so darn sad they can't go any further, and it keeps getting worse and worse and worse. The next thing you know, they've talked themselves into being depressed. Second point is that they'll start it in their feet, their legs, because they're mad. And they get so mad that they get depressed. And the third place is when they get anxious. They start it in their head again, anxiety, and they take it down into their belly, and they're depressed. So depression, anxiety, anger are handled a little bit different between men and women, but
Mm-hmm.
it's all in the hand.
Mm-hmm.
And that's why the Essenes taught us this technique, and they've been using it for 6,000 years, so I figure, okay, we can use it. And it works.
Mm-hmm.
It does work. So thank you very much, and we're done.
Thank you.